Right, good morning, everyone. My name is Charlie Zai. I'm Executive Vice President of Strategy at Bravo Wellness, where we work with employers, health plans, providers to manage member incentive programs and really help to move the needle on population health through the use of behavioral economics and other resources to help people improve their health. I am honored today to be joined by Maria Kannankutty from Blue Cross Blue Shield of Minnesota. Maria is Director of Strategy Execution for Medicaid at Blue Cross, where she's involved in a number of strategic initiatives, including the redetermination effort and leading the member incentive program strategy. And Maria, I'll let you introduce yourself and speak a little bit more about what you do and some of the activities that you do at Blue Cross Blue Shield of Minnesota.
Thanks, Charlie. Great to be here. Thanks for inviting me. I'm Maria Kannankutty. I am the Director of Medicaid Strategy and Execution, as Charlie said, at Blue Cross and Blue Shield of Minnesota. So my role really entails developing the strategy for Medicaid and continuing to innovate to bring new capabilities to better serve our members in Minnesota. So basically oversee a pipeline of initiatives from ideation to execution.
So it's been a little over 10 years since the Affordable Care Act authorized a 10-state demonstration project to provide incentives to Medicaid beneficiaries who participate in prevention programs and demonstrate changes in health risk outcomes, including adopting new healthy behaviors. Since that time, we've seen huge growth in Medicaid overall, and specifically in Medicaid managed care, as well as continued growth in Medicare Advantage. And today, Medicaid and Medicare plans use member incentive programs as an important tool to keep members engaged, to help them improve their health, and also to improve health plan quality performance. So Maria, we'd love to just hear a little bit more about the work at Blue Cross. Actually, let's start with a little bit of background about Blue Cross Blue Shield of Minnesota. You just share a little bit more about the health plan and different segments and all that good stuff.
Blue Cross and Blue Shield of Minnesota is a non-for-profit health plan. We have a 90-year history in Minnesota. We serve every market segment, and we serve 2.5 million members. We are the state's largest not-for-profit health insurer, and we also happen to be among the very first Blue Cross plans in the country. Now, Blue Plus is our health maintenance organization. It was founded in 1974, and it really contracts. That is our HMO is contracts with the Minnesota Department of Human Services to provide public health programs like Medicaid. Now, combined, Blue Cross and Blue Plus can be found in every Minnesotan, in every county in Minnesota.
Love to start with just kind of a high-level overview of the member incentive program at Blue Cross Blue Shield of Minnesota.
Sure. So the Blue Plus Healthy Rewards program, as we call it, has been in place actually for a while, since 2014, and it is available to Medicaid members under 65 years old. Members essentially receive rewards for completing key preventive activities, health activities like child and teen checkups, dental visits, or diabetes care.
The member incentive programs that we've worked with over the years and that we've seen and read about in some of the studies really focus on a whole variety of different things, from biometric risk reduction to care gap closure. As you think about the program at Blue Cross of Minnesota, what are the primary goals of the program that you have in place?
So the main goal of our program is really to provide an incentive for members to visit, to seek care, preventive care with their provider, and to keep members healthy so that we can prevent long-term health issues from arising through early detection. That is truly the main goal here.
And I imagine that the goals of the program really play a role in supporting Blue Cross's overall goals as a Medicaid plan. Can you speak to that a bit?
This is an important program for us. It is also aligned with our quality goals, our HEDIS risk scores as well. So our members, Charlie, face many barriers, right? They have food, housing, transportation insecurity. So offering a program that makes it a little easier for them to seek care and remove some of those barriers is very important to our goals. I'll just give you a couple of examples. We received thank you cards in the past from members who participate in the program to tell us, they use the rewards from the Blue Plus Healthy Rewards program to get a birthday cake for their child's birthday party that they otherwise wouldn't be able to afford. Or to put gas in their car. So this type of engagement with the program is really important to us. We're a mission-driven organization. We're here to serve our members, and these stories are really impactful to the mission and our goals.
We hear a lot of stories about how this program plays a role in helping to address social determinants of health and other resource challenges. So yeah, those are the kinds of stories that are so important and really kind of hit home. So I know we've talked about this program a lot over the last couple of years since we've been working together. What are some of the historical challenges you've encountered with the program? Kind of previous versions of the program and how it's evolved over the course of the last few years.
So historically, the program was only paper or voucher based, and it involved many manual steps. So the member had to print the voucher from our website. They had to take it to their provider, get the signature from the provider once they completed their care, and then mail the voucher back to us. Once we would receive the voucher, then Blue Plus would send a single-use rewards card to the member. So let's think about that for one moment, like a use case, right? Because we want to put the member at the center here. A household, let's just take a household with 4 children. If you take those 4 children to the dentist for their care, you needed to do all of those steps 4 times, 4 vouchers, get all of them signed, get each one of them mailed, and then receive 4 single-use gift cards. So many manual steps, and again, it wasn't the best from a member experience and use standpoint.
Think about just my own experience. If I had to do it 4 times and the voucher filled out and submitted and get 4 separate gift cards, becomes kind of a barrier to participation and really kind of engaging in the program. So you've had these challenges over the years, and Blue Cross has done a tremendous job of really addressing those challenges through innovation. I would love to hear a little bit about the innovations you've embraced and introduced to address some of the challenges you just described.
Be happy to. So first of all, we partner with you, Bravo and WEX, to create an innovative program and really improve the member experience in a number of ways. First, we introduced a digital platform to provide a more personalized member experience, kind of a one-stop place where members can track their rewards, see all of the activities that they and those in their household are eligible for. So a much more user-friendly experience. Another innovative aspect of the program, I think this is a one-of-a-kind program, frankly, from the standpoint of supporting accumulation of the rewards at the household level rather than the individual level for those under 18 years old. Another area that we worked closely together to develop and bring to our members is to make the rewards claims-based as opposed to voucher-based for most activities. So when we receive the claims from a provider, the member automatically now gets the reward as long as they are enrolled in the program. And then last but not least, we replaced the single-use reward card with a reloadable reward card. So now really households can carry one card with all of those dollars accumulated in a single card.
To improve the accessibility and ability to leverage the incentives and put them to good use. And to your earlier point, to buy that birthday cake, to fill the car with gas. It's on a single card and not keeping track of numerous gift cards. Very neat. I'd like to spend a little bit of time on the household concept. So I know we've talked about it quite a bit over the years, but just for the PHA World Population Health Alliance viewers, could you share a little bit more about the household concept and how it's kind of a unique data challenge in Medicaid?
That was quite challenging. It's been quite a journey to figure that out. But essentially, how that works is we wanted to create a way to link individuals in the household under 18 to the head of household, right? So that the head of household essentially would receive one card that would reflect the activities of everyone under 18 years old. And that is challenging because the population, our population is very mobile. We needed to find a way from a development standpoint to link those household members to the head of household. issue the card to the head of household so that then, they can't have that accumulation there. So it was challenging, worth it, because I think at the end of the day, it will make it so much easier for a single person to have all of the dollars on a single card and really be able to manage. If you have 4 children, 5 children, some of our members are really even multi-generational households. So to be able to manage all of that a little bit easier was definitely one of the biggest innovations we created as part of this new program.
And as you think about future innovation and the evolution of the member incentive program, what opportunities do you see?
That's a great question, Charlie. So, the biggest opportunity that I see is for continued innovation in the program is really making a more real-time connection for members to not just know that they have a gap in care, but to also help them close that gap in care. So I would love to be able to tell a member, look, if you have not taken your child for a well child visit yet, this is a provider closest to you. Click here to make an appointment. And by the way, you get to earn X dollars for doing that if you complete the visit by this date. That would be, I think, bring the program to a completely next level. I would also love to see the program made available in multiple languages in the future, so that members whose primary language is not English can also access the program more easily.
Yeah, I know that Spanish is coming soon, but there are innumerable languages that we need to address and include in the program, make it more accessible. But one last question. A lot of the PHA members work for health plans, both Medicaid and Medicare Advantage, and you've kind of been at the forefront of developing a next generation member incentive program. What advice would you have for a PHA member that might be early in kind of the development of their own member incentive program? What guidance would you provide as they continue to develop?
Put the member first. In terms of kind of a human-centered design principle, in terms of thinking, how do we make it easier for the members to accumulate the rewards, to use the rewards, to track the rewards. I would just say continue to put the members' needs first and ensure that the program is as easy as possible for the Medicaid population and other populations as well.
Yeah, it's super important. Maria, thank you so much for taking the time today. Really enjoyed working with you over the years and talking with you today about the program, and looking forward to a bright future working together and sharing more with PHA and our members and other organizations across the country.
Thank you for inviting me, and it's been great working with you as well, Charlie.
Looking for more answers in population health? Be sure to attend PHA's Innovation Summit October 25th and 26th at Top of the Hill in Washington, D.C. Learn more and register today at populationhealthalliance.org.